Last night, Governor Tony Evers proposed his $91 billion state budget, referring to it as the bounce-back budget to help Wisconsin recover and rebuild from the impacts of COVID-19.
News 18's McKenna Alexander breaks down the key points in that proposal as local legislators weigh in on which parts they support and oppose.
We can make excuses for the last decade of decision makers who cut corners, or we can commit right now to start putting people first.
Governor Evers' $91 billion budget proposal allocates state funding to many divisions across the state, but the most money is directed toward education. In the proposal, overall state funding for public and private K-12 schools increases by $1.6 billion over the next 2 years, which is the largest increase ever. The proposal includes a $47 million boost to mental health aid in schools, something Representative Jesse James says is critical for students right now.
I think the numbers speak for themselves on the increase and detriment that this pandemic has had on our youth.
Other allotments in the budget include long-term care facilities, child care, agriculture, lowering prescription drug costs, raising the tobacco age to 21, and the full legalization of marijuana.
We've seen states around the country be able to really increase a lot of revenue and fund schools and other programs by taxing marijuana the same way that we tax alcohol.
I don't think it's appropriate to always be looking at the dollar signs. We need to look at the impact that this would have on the future generations yet to come, or even that are here right now.
In total, this proposal calls for more than $90 million of state spending over the 2-year cycle, with the budget standing as it is now. It would leave the state operating at a deficit, which Evers says is justified given the pandemic. However, Representative James disagrees.
It's just like us with our own home budgets. We can't spend what we don't have, and we really shouldn't. And the same concept I kind of bring to Madison with me looking at this budget here. It is a very hard pill to swallow.
Other key proposals include raising the minimum wage to $10.15 an hour and creating a state health care exchange through the ACA.
Don't let anyone tell you we can't afford to make health care more accessible while saving your hard-earned tax dollars.
In Evers' budget proposal, the initiatives are largely funded by more than $1 billion in tax increases. But for the average taxpayer, taxes would likely be cut by a few $100s. To see more key points in the budget plan, head to WQOW.com.